Yeah, good morning. Just finished my tea and thought of talking about something that I felt needs to be talked about. I have expressed my view also a few days back that I'll be talking about it. I've been thinking about it and now I think I've gathered some of my points. So let's voice it. And once you hear it, let me know what's your thought and what's your views related to what I'm going to speak about now. So I will start with a confession. The confession that I love natural medicine. I love Ayurveda. I love Unani, Siddha. Thousands of years of observation, documentation, and refinement. That alone deserves an applause. Yes, an applause. Not cancellation for sure. But loving something does not mean switching off your brain. Because here is today's uncomfortable truth. Some natural products are being sold like ancient wisdom while behaving like brand new chemical experiments. And nobody is talking about it. So let's talk calmly, rationally, with chai in one hand and science in the other. We have been trained to believe natural equals to safe, synthetic equals to dangerous, which sounds very cute but also scientifically adorable because cobra venom is natural, poison ivy is natural, arsenic is natural. Nature is not a wellness influencer, nature is a chemist. And a brutal one. Plants are basically chemical factories. Each herb contains dozens and sometimes hundreds of active molecules. Now imagine 10 herbs, each with 50 active compounds put together in one capsule. Congratulations, you did not make a traditional remedy. You created a small pharmaceutical universe. Yet many proprietary herbal products enter the market without human clinical trials, interaction studies, and published safety data. But with shiny box, Sanskrit name, green leaf logo, and the word natural in 72-point font. Beautiful branding, interesting science. So let's be fair. Classical formulation described in authoritative texts has fixed ingredients, defined ratios, defined processing, defined indications. That is structured knowledge. But today's market loves new improved herbal power plus ultra formula, which basically means let's mix a little Ayurveda, add a little Unani, sprinkle a little bit of Siddha, throw in modern extracts, call it proprietary, now pause. From a pharmacological perspective, the moment you change combination, ratio, or processing, you have created a new drug entity. A new entity normally requires toxicology, dose finding, human safety, interaction testing, but in many cases, these products take a shortcut, a very herbal shortcut. Interactions, the invisible problem needs to be focused into. There is a part nobody markets. Herbs talk to enzymes. Some herbs speed up drug breakdown. Some herbs block drug breakdown, meaning your blood pressure medicine may stop working. Your diabetes medicine may become too strong. Your blood thinner may turn your body into a leaking faucet. And now add herb interactions. Plant A increases absorption of plant B. Plant C blocks elimination of plant D. Suddenly, your gentle detox syrup is doing Parker inside your liver. Fun? Not fun at all. And most proprietary formulas are never tested for this. Even if the formula is perfect, let's consider the formula is perfect. What about heavy metals? Pesticides, microbes, adulteration. Multiple investigations worldwide have found herbal products containing lead, mercury, steroid, painkillers. Why? Why is that? Because quality control is expensive and shortcuts are profitable. Nature doesn't add paracetamol, humans do. Doctors are now reporting herb induced liver injury, kidney injury, bleeding events, severe hypoglycemia. Patients say, but it was Ayurvedic. Doctor replies, I believe you, but your liver is designing. This is not anti traditional medicine, this is pro patient survival. WHO, that is World Health Organization, does not say ban traditional medicine. WHO instead says traditional medicines must have quality control, safety monitoring, interaction evaluation, pharmacovigilance. In translated version, respect tradition but stop gambling with biology. The core problem is that we created a strange double standard. If a company invents one synthetic molecule, 20 years testing. If a company mixes 12 herbs into a new combo, bro, it's natural. Science does not care about marketing departments. Your liver definitely does not. This is not a hopeless situation. Actually, it's fixable. Imagine this future. Being in the industry for such a long time, being in the industry currently, I always feel there is always a systemic cure for this quick fix. There's nothing called quick fix applicable when it is human health, when it is human body, because that's a very, very complex structure, internally as well as externally. Proprietary herbal products undergo phase 1 human safety trials. Interaction screening is mandatory. Phytochemical fingerprints needs to be published. Batch quality certificates accessible by QR code. So let's do that. Strong pharmacovigilance has to be done mandatorily before a product is released in the market. The result? Traditional medicine becomes stronger, not weaker. More respected, more global, more trusted. Not Instagram famous, scientifically respected, big difference. My position on this is very, very clear. I am not against Ayurveda. I am not against Unani. I am neither against Siddha. I am against untested mixtures being sold as unquestionable truth. Tradition deserves reverence. Patients deserve protection. Both can coexist. So before you buy, my take home message would be ask, is this classical or proprietary? Is there human safety data? Is there quality testing? Can the company show it? If they get offended, that is your answer. Natural medicine has enormous potential, but potential without responsibility becomes a liability. Let's upgrade traditional medicine from blind belief to be created as an informed trust. If you found this useful, share it with someone who believes natural means safe. Because the goal is not fear, the goal is smarter healing. That's how it should be. Thank you so much. Appreciate it for your patient hearing. Let me know what do you view, how do you see it, what do you feel inside yourself, and let me know how many times when your hypertension shot up or your blood sugar level went into a different vulnerability, your lipid level went into a vulnerability. What is that you have resorted to? You have resorted to a product that has proven efficacy, or you have resorted to a product which you know it may deliver, it may not. You don't know whether it will fit your physiology, your your pathophysiology. You are not sure about it. So if you are practicing the same, let's make the entire environment, entire industry also practice the same. Let's not take anything for granted, anything just for the sake of taking it.